Hello, I'm Dr. Robert Cagle. I specialize in joint replacement surgery with the Mako robotic assistants, and this is my good patient here, Kinji. So tell us a little bit about what happened as far as where you had surgery and going to a hospital or a surgery center and your thought process on that.
Oh, I think definitely with how COVID changed everybody's perspective on everything. But even before that, I knew joint replacements were getting better, surgeons were getting better, technology was getting better, that it can be an outpatient procedure. I didn't want to stay overnight. And especially with the COVID pandemic out there, why risk being in somewhere where you have a higher chance of possibly being infected? So when you mentioned that this can be an outpatient procedure, I'll get you home before dinner time, it checks in all the boxes for me.
Yeah, I know that's been a real shift in how surgeons and patients are thinking over the last few years. As far as 20 years ago, people stayed a week in the hospital. Now we do them where my average length of stay at the surgery center is 6 hours. And with all the techniques like the cosmetic hip replacement approach that I use with that 4-inch incision, and there's almost no blood loss. I don't even check labs on people anymore because the blood loss is so minimal, and people go home and sleep in their own bed. Now after your hip replacement, so you're in the surgery center, you get discharged same day, and you said you're 4 weeks out now from your hip replacement. What's that last kind of 4 weeks been like for you?
Well, I haven't used the walker or any of the opioids since the day of surgery, and I really think I needed the walker just because of the anesthetic. But I was able to walk around the house, obviously gingerly and taking care of it, just something new for your body. But during that first week, I would say I wasn't in much pain at all. If anything, just uncomfortable at night at times, and if you have to go to the bathroom in the middle of the night. Those were the more, oh man, this kind of stinks moments, but every day it got better, and every day I took less and less of the medications. And really for the last 2 weeks, I'm telling myself, don't do too much. Even though it feels good, just don't do too much.
Yeah.